Ethical challenges. In light of manifold possible applications of technology in therapy and research, there is a discussion about related ethical principles in their field of scope. Research in virtual environments should follow all standard ethical principles and has to take the special setting into consideration. Interestingly, especially qualitative researchers have dealt with ethical aspects of researching gaming environments over the last years. We suppose that the same ethical principles, which pertain to conventional psychological treatment and therapy, should also be applied in technology-aided psychological treatment. The manifold risks psychologists are confronted with, as well as the ethical dilemmas that may arise from the adoption of technology in the realms of treatment, may be significantly different from those encountered in conventional face-to-face counseling psychology. In online-based communication, psychologists are confronted with the same probability of encountering distressing information, for example a suicidal attempt of a client, yet online therapists are a lot less likely to fully apprehend the severity of this attempt if not being confronted with the patient face-to-face. Furthermore, absolute certainty about a client's true identity is difficult to be achieved in digital settings. It seems that these facts make it more difficult to provide effective treatment. Last but not least, it is necessary to consider negative side effects of digital games, as pointed out above. We believe that we can't create digital games with a specific psychological protocol, even if evidence-based and studied before, and leave the patients alone. There has to be a certain level of guidance from a psychologist. It is necessary to consider these facts to engage in a discussion about implementing new, even more specific guidelines for technology-assisted therapy. Ethical guidelines regarding the use of VR and digital games are scarce at best. To date, only few mental health organizations, respectively psychologists' associations, have issued specific regulations, most of which pertain to online counseling or e-therapy. To date, the American Psychological Association or the European Federation of Psychologists Associations lack specific regulations. On the other hand, specialized organizations such as the International Society for Mental Health Online, ISMHO, or the American Mental Health Counselors Association, AMHCA, stress the importance of taking into account basic ethical principles like beneficence, nonmaleficence, autonomy and confidentiality when implementing any sort of technology-assisted training. Only then, ethically sound treatment of patients can be ensured. First of all, in terms of beneficence and nonmaleficence, it has to be ensured that clients are intellectually, emotionally, and physically capable of using technology-assisted counseling services, and of understanding the potential risks and/or limitations of such services. For example, some minor groups of people who never had any contact with technology, for example, a personal computer, or elderly people may feel intimidated by VR or digital games and may not accept them as tools for psychological treatment. Compliance may be hampered for this group of clients. Additionally, there are some mental disorders for which specific technology-based treatments are not recommended. Because of their imminent difficulties of separating reality from fiction, it is argued that VR can have negative side effects for some schizophrenic and psychotic patients. Patients in crisis situations as well as borderline patients, who are even in a greater need of face-to-face interaction than an average patient, should not be treated exclusively via the internet or using solely VR applications. We emphasize that special focus has to be put on the informed consent process when intending to use technology or conducting treatment via technological applications. Patients have the right to be fully informed about the potentials and the limitations of any technology, such as the circumstances under which it can or cannot be applied to the patient's situation. Patients have to be provided with the information about what data is being collected about them when using the technology. They should furthermore be informed about the location it is stored at and about how long it is intended to remain there. To mitigate breaches of confidentiality, all measures have to be taken by the treating psychologist to ensure secure data storage no matter what kind of data is collected, for example physiological measures when using biofeedback. When providing internet-based services, psychologists should utilize secure websites, firewalls and encrypting programs. In order to avoid any harm to patients, psychologists should possess adequate expertise concerning the technology they apply. In terms of serious games for health, this includes knowledge about maladaptive gaming behavior as well as any other negative side effects. Psychologists are to assure that their treatment method is in no violation of local laws or ethical regulations such as professional membership organizations. Although not directly connected with ethical aspects regarding humans, the possibilities of VR to reduce the suffering of animals used in treatment has to be mentioned and underlined. Confrontation in virtue seems to be an extremely powerful form of exposition that might not only be used as adjunct, but even as replacement for in vivo therapy. As described above, there exist a lot of different forms of specific phobias, and a relevant part of those pertain to animals. Exposition in vivo clearly means that animals have to be handled by the therapist and by the patient for a long enough time to let the anxiety level go down. Speaking of a session that might last up to a couple of hours, the stress on the included animals is obviously unbearable. That stress may reduce the quality of life of the animal and lead to behavioral disorders as well as physical illness, or under the worst circumstances it might even end the animal's life. For example, including wasps in order to treat spexophobia leads to the death of many animals. They tend to kill each other in an area that's not large enough in relation to their natural environment. The question has to be asked if the suffering of animals is acceptable to treat a patient's phobia. Technology offers a very interesting alternative that shows a way without the discussion of ethics in human-animal interaction or thoughts about animal experimentation. Working with animals in virtue includes all positive aspects of virtual environments that were mentioned before and does not harm any other living being while having a powerful effect on the patient. Rethinking the ethical problems of harming an animal or worse might be a burden for some professionals that can easily be reduced by employing technical adjuncts to therapy. All in all, the integration of technology in psychological treatment has experienced a vast surge during the last couple of years. Ethical boards and psychological researchers are even more enforced to consider possible harm as well as potential that may arise from VR usage and transfer them into comprehensible, internationally applicable ethical guidelines.